Dear ladies and gentlemen, a very warm welcome, Hans, as well. Ciao. A very warm welcome to one of the highlights of today's Swiss Startup Days. I am very grateful that at the end of the day we could arrange that Simon Michel could join us, not from the Parliament directly, but from another important reunion. Thank you very much for coming. Today's topic is very simple. Startups are the SMEs of tomorrow. And Simon obviously will elaborate on that. So Ypsomed as well was a startup and today is one of the most relevant SMEs or companies in Switzerland. And at Startup Days we truly believe that we need to work on this relationship between SMEs who are established and they got a lot of knowledge, but sometimes also got the problem that not invented here, and the startups who have the innovation and all the energy and new ideas. So we want to work on this relation and on those building bridges. So today, Simon will elaborate on his experience at Ypsomed on this relationship, but I'm also very grateful that on short notice we launched a club. It's called the S3, the Swiss Startup Supporter Club. Under the chair of Simon Michel, we try to establish this relationship much more intensively than we have done before. So please welcome with a very warm applause Simon Michel and Andreas Schneider here on the topic of SMEs and startups.
Thanks, Dominic, for having us. Indeed, I think it's a very important topic, and it has been time to actually launch it, and so excellent initiative. What we would like to do is to not spend too much time on the Ypsomed case itself, but kind of share with you our learning. We will have 10 points to share with you on how to optimize the collaboration between SMEs and startups. So this will be both for you young entrepreneurs in the room and more senior SME CEOs in the room. So try to have something for both of you. With me here today is Andreas. Andreas is running innovation. Maybe you want to give a couple of words on yourself and how we're going to spend this 30 minutes here.
Super. Hey, first of all, thanks a lot for having us. We're excited to be here and share our lessons learned out of 2 cases, basically, where we as Ypsomed have also collaborated with startups in the innovation ecosystems. And so as Simon has mentioned, and myself, I'm responsible for the innovation strategy department at Ypsomed. And our goal is basically to deliver proof of concept of new growth opportunities for the organization. And what we're going to talk about today is basically quickly highlight the Ypsomed case, just that you have a little bit of context of who we are and what we do. But then secondly, also elaborate on a couple of case studies and the lessons out of those. And we try to also flesh these lessons in a way that we can maybe provide a bit more of a nuanced view into how the collaboration between startups and SMEs could be maybe a little different comparing startups collaborating with the big multinationals out there. And also, of course, then curious to see your views and perspectives on that, on what are these unique elements, what's that unique flavor that we could add as a SME when collaborating with the startups and the entrepreneurs out there.
Excellent. Yeah. Great. Shall we start?
Please, go ahead.
All right. So who we are. This is what we do. We prick people. We build the products that are responsible to bring liquid drugs in our bodies. It's not just insulin, it's very broad. We work with all big pharma biotech. And this is not just for older people, also young people, a girl with type 1 diabetes, but we have, of course, a lot of elderly people. It's asthma, it's migraine, it's chronic diseases, it's autoimmune diseases, and we will talk about it, obesity. So we are the device manufacturer. We are manufacturing the device. We send the device to pharma, and they marry it with the drug. That is what we are doing, essentially. They sell it. It's B2B. Roughly $500 million in revenue. And the second business is our B2C business, where we have insulin pumps that we sell directly to type 1 patients around the globe, where we are the company to bring the product to market. So those 2 businesses, this is what Ypsomed is doing, very fast growing. We have a lot of support We profit from the fact that therapies go home from hospitals, not just because of COVID, already before, a lot of tailwind. We profit from the fact that new drugs have to be injected. We profit from the fact that drugs can be copied, biosimilars, so the market is growing, and we profit from digitization. This is what we do. Essentially, we are a plastic molding company. We mold over 10 billion plastic parts per year, and those plastic parts we assemble highly automated into such pens. So it's a scaling business, it's a growing business, it's a really growing business. We are one of the fastest growing medtech companies in Europe, 20% top line growth at an EBIT margin of 30%. It's quite attractive. So we have the cash to grow. And one reason why we grow is this. You have all read about it. It's the new wonder molecules out there. You inject yourself for 1 year, once a week. You lose 25% of your body weight without any side effects. One negative element to it, though, if you stop, you go back up. So it's a yo-yo. You have to keep on. I mean, pharma is not healing, unfortunately. Pharma is treating. But this is just one example why the industry is transforming, why Ypsomed is transforming. Adipositas is a global pandemic with over 1 billion people. Type 2 diabetes is a global pandemic with 500 million people. And eventually, they all need drugs to inject. And new drugs have to be injected, can no longer be swallowed. That's our case. Clear? Good. So it's not just obesity, it's very broad. And this tailwind forces us to invest. We invest over 1.5 billion Swiss francs over the coming 4 years in new factories, in automation, in lines. We have a large site in Schwerin, next to Hamburg, where we manufacture 250 million devices. We're going to triple that. Schwerin 1, we built Schwerin 2. We spent 500 million for this factory. We had the groundbreaking ceremony 2 months ago. So this is really what we have to do. It's an organizational job. We have built up Changzhou site in 13 months. We are going to open it in a month from now in Shanghai. We regionalize. This is what Ypsomed is doing. We are growing. And next step, not just because of Trump, we decided before, we built our factory in the US. So it's a growth story, and you can actually ask yourself, so why to spend time with startups? Why to innovate? I mean, we are growing. We have some new headwinds coming. Today we live in an oligopoly. We are 2 players mainly, but because if you do 30% bottom line, it's a honeypot, you have bees coming. So we have to prepare for a time where new competition arises. And this leads automatically to a price pressure, i.e. for us, cost pressure. And eventually, IP will end. And our products that are protected now until 32, 34 will no longer be protected. And there's a new trend in our industry, that's aggregation, where large players try to offer everything, move us into tier 2, we're no longer tier 1. That's the reason why we have to spend money for innovation. We cannot lay back. The next 4 years are fine, it's all right, it's good, we grow, it's organic, but the world is changing for us, will change for us, and we have to innovate. And Andreas and me, we would now like to explain 2 cases where we have collaborated and still collaborate with startups. We do that every now and then. Andreas is the lucky guy in our company with the largest budget. He is spending one of the largest, almost.
Almost, yeah. I take a note, yeah.
Take a note. Collaborating with startups for elements that are lacking, where we are not there. And one example is our insulin pump. Our insulin pump is a device developed and manufactured at Ypsomed. Our core competence, my dad started that business 40 years ago. He stepped out 25 years ago, but this was his legacy, and we can do that. We understand how to build insulin pumps. But we never really understood how to build infusion sets. If you want to bring a drug in your body, you need an infusion set. We never had that IP in our home, in our company, never knew how to glue this stuff together. So our way was not to collaborate, our way was to acquire. We acquired a company that makes such sets. Now we know how to make sets. Easy. The next potential way how to grow your proposition is by partnering. a therapy is not just a pump that infuses, it's also a sensor that measures. And you see people, maybe some of you use it, have a sensor on the arm, they measure the glucose. The glucose is used to bring insulin in your body correctly. But what we are lacking is the brain. It's the software that steers the data. The data from glucose calculates and tells the pump what to do. This we did not have in-house. It's quite complex. And here, it's one good example where we partnered, where we decided to partner with a company, a professor in Cambridge, great mind, spent 15 years of his life working on those algorithms that steer our pumps. And he was searching for a partner to actually bring his life, his legacy into a product. And we were there. And we kind of went into this relationship, partnered with ChemDiab without thinking what we do when we both get successful. And we will deepen that with you when we go through our 10 steps, what to do early enough when you go into a marriage between SME and startup or startup and SME. But before we deepen that case, I suggest we move to a second case to give you an idea on where we collaborate with startups. Case 2, Andreas.
Hey, super. Thanks a lot, Simon. And the second case has many similarities with the first one. But I think we're going to cover that just later on. But let's talk through this second case as a illustration of how we could collaborate with startups in a bit more detail. So Simon was just highlighting, we are generating or we are developing and manufacturing these devices. They are for home treatment. They are for self-care. And, keep that term repeating again. It's about self, right? And more often than not, we hear statements like that patients are at times overwhelmed. They don't quite know how to treat themselves. They don't quite know, what comes with it, in addition to just injecting yet another drug every other month or so. So it's really, we need to come up and step up in terms of how to best support patients, caregivers, and all of their surroundings in order to ensure that patients not only start therapies, but also stay on therapies. Because as you might know, non-adherence or patients dropping off therapies is a huge issue. And even for therapies where you'd expect, it sort of naturally happens that you would want to stay on that for life-threatening diseases, people discontinue the treatments for very different reasons. So there's definitely a lot of challenges, despite all of the tailwinds in going into self-care. There's still a lot of challenges around how to ensure that patients stay on therapy and how to ensure that they sort of enjoy that ride, whatever is enjoyable about that. One common approach that we also at Ypsomed have taken is that we try to move from self-injection to therapy self-management, right? To really empower patients with the appropriate tools in order to have more of a proactive approach to managing that journey themselves. And that also translates into, of course, a story in terms of how to build up the product portfolio that matches these requirements. So it's not just about these mechanical devices, it's about making these devices smart connected, for instance, in order to capture whether the dose has been administered, and if not, that we can escalate or trigger certain interventions with these patients. And ultimately then, the goal is to have sort of a comprehensive 360 view on patients, caregivers, and integrate that into the broader health ecosystem. Now again, if you reflect a little bit about what Ypsomed is and what do we do, well, probably we're not going to be capable to drive all of that journey on our own. So we have to partner. And we did that as well. This is an example to highlight how this could look like. So we did partner with a digital health startup, a startup that has been working for multiple years to create such a digital health ecosystem, patient apps, HCP portals, interfaces, to digital health records, etc., etc. And the goal was basically to now integrate our devices and our connected devices into these broader digital ecosystems of that very startup. So again, a very clear trajectory towards building a product, a very clear logic in terms of complementarity driving these collaborations. We are good at injection devices. They are mastering the digital ends. So let's marry that and let's bring that together. So to Simon's point, I think it's really sharing a lot of commonalities despite we talk about quite a bit of a different context, but the core logic of what's been driving these collaborations has been sort of quite a bit similar. And that's why, we've been sitting together and we were thinking about, hey, are there some lessons learned? Are there some sort of, key ingredients that, from our point of view at least, make most sense if we now talk through these two blueprints of how we've gone with collaborating with these startups? And this is basically what we now would like to share and sort of reflect a little bit also from the both angles, taking the view of us being a small, medium-sized enterprise, but also what could be sort of the lessons learned for that other party, for startups. How is it for you basically to engage with us a little differently than if you were to talk to the big, MNCs out there? First, I think it's important that we really early on start to discuss, align, and agree on what's that go-to-market path. And as you've seen that before, these puzzle pieces are, just not by accident black and white. Much of what we do is driven by complementarity. So we look into what is it that we have and what is it that we still lack in order to come up with a joint value proposition. It's not just about adding yet another device to our portfolio, but it's about creating joint value. And accordingly, we also understand that because of these complementarities, we do see markets differently. We might have different entry points to our pharma partners, as an example. If you talk about Sidekick, they've been out there for 2-3 years, pitching to pharma, pitching to very different stakeholders than us. We've been around for 30+ years as a device manufacturer, having well-established relationships on that end, but maybe not on that other angle. So be clear early on how do we foresee to launch that onto the market. Secondly, agree on pilot goals and outcomes. Again, important here is, yes, there is need to pilot, because if you partner with SMEs, just going after the logic that we provided here, it's about building a new joint value proposition. And yes, we acknowledge that startups invest a lot of time in validating their value proposition, and us, we do the same for plus 30 years, but that joint value proposition is new, so we have to pilot. Yet at the same time, we also acknowledge that, well, startups do not have infinite resources. You have hard time pressures, you have to pitch again to investors, you have to raise money. So we have to early on agree on what are these pilot goals, and what are outcomes. So for instance, that we time box pilot studies, that we have clear objectives on with whom do we talk, by when, who takes the lead, etc., etc. I really take that in a stage gate approach. A third lesson that we have also learned, and it's probably a tough one to be fair, is around IP rights and boundaries. And again, I think what is a little different here comparing to collaborate with a larger organization is we have that joint value proposition in mind. We want to do something together. We want to jointly create value. That, however, also translates into, hey, there's some overlaps. There could be couple of scenarios, couple of cases where we have to very clearly demarcate and draw the boundaries in between what is with Ypsomed and what does stay with the startups. And I think that is a discussion we've also learned you should really have early on in order to create not these uncertainties or inconsistencies along that journey. Because we strive again for the joint value proposition, we build things together, it's a co-development in nature. So how do we draw the lines in between, boundaries between IP, background and foreground IP between the two organizations? Another element is important, be aware of mutual dependencies, and I think really want to highlight the term mutual here. That's also what Simon just mentioned before. We, as we grow together, we will become depending on each other. Think of this algorithm and the pump. As of now, the current state or standard of care is an algorithm-driven smart loop pump system out there. So without that algorithm, we would confront or we would see serious challenges. But again, an algorithm on its own is useless because there's no hardware to actually deliver that insulin. So be aware that as we grow, as we move along that journey, we will create mutual dependencies, and that will impact on very different levels, including valuation, including exits. And I think that's something that you later on also will cover, Simon, as you grow through the other lessons that we have learned. And another super important element that we think is often a little bit neglected is we have to emphasize continuity and ownership. And ownership in terms of who's driving that relationship. Again, it is clear startups do not have a lot of redundancies. But I think, again, the difference comparing us as a small, medium-sized enterprise with the large, MNCs, neither do we have, loads of redundancies. So be aware of building these trusted relationships, but also be aware of building up contingencies, backups, plans Bs, if for whatever reason people change. Because ultimately these relationships, these partnerships are all about people. Of course we talk about technologies, but in essence who's driving that is probably the most critical element. So be early in anticipating these shifts. People might change, people might leave, co-founder might leave, new investors come in, they have certain preferences to build up new management teams, etc. And that is also equally true for the other side of the equation. Also, we at SMEs, we could leave, we can change. And then, of course, you are confronted with new colleagues to drive that forward.
Excellent.
Simon, over to you for another couple of insights and lessons.
Five more to go before we summarize and open for questions. One key element we have seen is branding. In the end, you have, and Andreas pointed out very nicely, in the end, it's all about the joint proposition out in the market. And does the joint proposition really need to have the brand of the startup in there? Does it really matter for the end market? Maybe not. But how can you convince the founder of the startup not to have his name on your product? So agree on it early on. We had discussions, have this second logo nobody understood on that product, and he wanted it. It was so important to him. And agree on branding early on. Agree on valuation and exit early on. That's a difficult one because, especially in a one-to-one relationship, and there are some out there, you grow value on his or her side because of you. So the valuation grows as you get successful together. But it's you that grows as the valuation. So a very important element. And our learning is that we just tackled this topic very, very early on. Very early on. How will we react if we reach that or this step? If we reach that milestone together, do we have the possibility? What's your exit? What's your succession plan? Often those, and it's not always young people. We have now contact with a couple of elderly professors, very senior people, that we know that they will not be there for 10 more years and run. So you have an exit. Sometimes you don't have this opportunity, but something very important to be brave and bring it up early on in early partnership discussions. How would we do that if we were to make you an offer? From what step on could we make an offer? And agree on those high-level terms and conditions, on those terms to take control. What does it need? Under what conditions would you do it? It's not just the money. You would have a seat in the board. How could we further develop? Is it just a license? I think those elements really need to be agreed early on. Otherwise, you have discussion. As an SME, you're in a weaker position, but maybe also as a startup, you're in a weaker position. So from both angles, it makes sense to tackle this early on. Number 9, and that's probably a key element, from the very beginning on, try to create value for both parties. It has to be fun. Now, if it's not fun for the startup, if they don't create money on their side, it will not fly. The case has to be, in a collaboration, has to be right for both parties. And last but not least, and that's especially for us, slower, larger organization, be open to learn from unconventional, maybe less regulated, leaner processes. Something we know, and we come from there, as Dominic rightly said. We once were there. Now we have a size where it gets a bit more regulated, and we can profit a lot from this thinking. And this openness is something that brings us forward. With that, let us summarize quickly those 10 points. Our learning. Maybe Andreas, you wanna take that, and then we open for a 10 minutes Q&A. That's the moment where you take out your phone and take a picture. So you have the learning of this session, and then we go on to the next session.
Social media ready. Good. I'll let you take your pictures, but just quickly walk you through that again. I think When pre-discussing and aligning for today's session, we were sort of convinced that there is a different trait, there's a different quality when it comes for SMEs to collaborate with startups and vice versa, if we were to contrast that with the larger organizations. And I think there is really this focus on complementarity, so we have that unmet need in mind. It's not that we can afford a portfolio of collaborations just for the sake of it, but it's really we have that specific need, and that creates attraction, which is very positive, because we have that productization in mind, but it also comes with a number of challenges that we may want to tackle earlier than if you were to engage with some other organizations. And I think also the element around complementarity is something that is super striking and very important to us, that we look out for what is lacking for us to build that new value proposition. We built that joint value proposition, and that again translates into a number of challenges that we think are a little bit more pronounced when startups were to interact with small, medium-sized organizations rather than the large organizations. Hey, and with that, Simon, we look forward to a more of an interactive discussion. But before doing so, the last lesson, we haven't shared that yet, is also be patient. And I think that's equally true for the both ends. So us being open and being flexible to these new approaches, to these innovative ways how we innovate, but at the same time also startups have to acknowledge that there are certain rhythms, certain paces you have to just simply accept when working with organizations like ours, specifically true if we talk about regulated industries like the pharmaceutical world.
Perfect. Thank you.
Good. Hey, and with that, look forward to an interactive discussion now. Thanks a lot.
Exactly what we. Thank you very much, Simon and Andreas. That was exactly what we discussed, and I believe that this list will be a legendary list when we say in 2025 we started, the recipe for collaboration. So my question is, as I understand, you try to solve very concrete challenges or problems, right? So how do we further develop the platforms? And then you look for startups to collaborate. My question is, and we also discussed that, what about the innovation culture at Ipsomed? So you said, yes, be open, and we see a fish jumping from one pot to the other. So how do you, is there any benefit of working with startups, if those small renegades, inside Ipsomed, so that people enter your office with new ideas, kind of like spin-offs from Ipsomed? So could you elaborate on the startup culture inside your company?
So maybe let me start and then give you the word. It's your domain, but all I can say is that we are doing it quite structured. Actually extremely structured. We apply software development skills and tools and methods to innovate. As being a person who did St. Gallen and economics, that's sometimes a bit difficult to invent on order. But it's something that Andreas can definitely outline how we do it. We had tech scouts in the US, in Israel, in China, people out there who collect stuff, and we stopped it again. And moved more in the direction of we go out and seek once we see a need. I have strong. So we do both things. Of course, we have a very strong interaction with the intelligence market that tell us where we have to be in 10 years. You just come from the States, where we have strong interaction with our clients to ask them what do they need tomorrow, in 5 years, in 10 years. And we also have a lot of freedom in the innovation team, where we give people budget to think, right? To come up. I did my first career was in telecom with Orange, and I was responsible for video telephony. And it was in 2001, and I built this business case, and it was very obvious. Everybody would, but it was too early. It was before iPhone, and but without having it and using it, you could not have thought of. So it was really you had to. This was a technology-driven innovation before the market really demanded, and everybody bought the smartphone. So how are we innovating at Ipsomed? What's the process? How are you doing it?
I think fundamentally what is important is that we try to retain that innovative entrepreneurial spirit of what's well known in the startup scenes out there. Of course, with certain constraints, with certain formalisms that we also have to act on, and we're ultimately a stock listed company, so there are certain mechanisms that we have to deal with. I think as a basic principle, what is important to us is that we try to decouple innovation from the rest of the organization. Right? So we have a dedicated team, we have dedicated budgets, we have dedicated, very trimmed down, lightweight frameworks and processes, because obviously, we are in a very regulated industry. And if we were to start from the very beginning with design controls, change controls, ISO standards, etc., that will kill things right away. So we are acutely aware that we try to decouple that in terms of creating our own little ecosystem. But at the same time, we also have to be mindful of not creating that ivory tower, right? That we still interact with the outside in terms of within Ypsomed, but outside of innovation. And we have sort of a routine process in place, and I can sort of proudly say that I believe this at least has turned into a routine by which we regularly engage with stakeholders, with the product teams, with account and business development, with our product managers, with market intelligence, that we really have all of that together. Secondly, as sort of a key ingredient as to what we do is we see innovation not just as technical implementation, but really try to flesh out innovation from multiple angles. Viability, desirability, and feasibility. And that is sort of in a well-known framework out of the startup scene, that you really try to understand not only is that technically feasible, but also how can we capitalize on that as Ypsomed? And is there anyone out there that's hopefully going to like that? Liking is a bit different here. We're in medical devices, but still, how does that fit into the broader healthcare ecosystem? What are the key stakeholders? What are potential hurdles? Again, just thinking of moving things from hospital to home, that comes with so many hurdles, so many, challenges, reimbursement schemes, HCP incentives, etc., that you all have to sort of very carefully weigh that in. But yes, nevertheless, if we were to talk about, us comparing it with these startups we've worked on, they probably describe us a little bit more rigid, a little bit less flexible, as they do it. But at the same time, we always have a very clear path towards productization. And I think that's also important, that it's not just about, playful engagement with whatever technologies, but we have that strong link with the core. And it has to translate into some sort of a viable business model that also fits with the broader organization.
And after the innovation phase, 50 people that work on 20, 30 projects in parallel with sprints, we start the development phase. 500 people, and then a regulated phase. And we make a quite clear cut of, obviously we give teams and we bring them over and they work, collaborate into a certain phase, but it's a clear cut between R&D development, innovation and then R&D development. So we take it apart, and that's probably for most of you how you work. For us, it has been very important to give the freedom, the flexibility to innovation, to be fast, try, and continue.
You're not facing culture clashes when you integrate solutions from the outside, because usually startups will, they have a DNA of the beauty of imperfection, and you as a big SME, you have probably the beauty of perfection. So sometimes you have a clash, because I can imagine you as an entrepreneur and you as a specialist, this field, you adapt well to this culture, but some of your employees might not like it, the way that you want to integrate imperfect ideas. How do you deal with that culturally?
Hey, absolutely. I think we're not prone to that, and I think that's also why these lessons are so important. Like if we were to, lesson 2, agree on pilot goals and outcomes, that is not just by chance on that slide. I mean, that's sort of a hard lesson we've gone through. When our teams, speaking of what is a validated value proposition, we can continue to engage with our pharma clients out there for years. And, guess what? The more you talk, the more questions you get. And we're in a science-based industry, and I think that's not helpful in many ways to sort of rapidly advance concepts and push that into clinical development. So yes, I think there is a clash, but nevertheless, I think if we both are aware of that and we can structure our collaboration accordingly, there's ways to manage that.
especially number 10. I mean, to add to that, be open, and and we have to be open to separate. Then you must really overrule corporate regulatory, corporate quality. You say, look, this is now they work separately on it. They have their quality system, and we try not to interact. That's also an option. We try not to interact on the product level or the proposition level. You have to. On the product level, you don't. And then you actually allow the two cultures, different cultures,
to coexist,
to coexist, to enforce. But you have to be open, and it needs some order from top down. Look, let them work. Let them work. If you give them our quality system, it's. That's
what I wanted to hear.
Yeah.
Well, how much time, Andreas, you and your team are spending on the screening, and how much on implementing and discussing that? I heard that you gave up like this radar, or more and more you're pain-driven, you're looking for a solution, but I can just imagine that you will be approached many times by many startups and all that. So how much is like the screening process and talking to them and then giving it up, and how much is really the work together with them?
Yeah. Hey, it's a difficult one to sort of really put that into hours in terms of how that balance is going to look like. But I mean, the good news about our industry is it's very predictable, right? We look into the pharma pipelines. We hopefully going to see what's going to be out there 3, 5, 7 years out. You know, maybe a little bit longer even, but that's going to become a little tricky. And you know, we are sort of driven by that logic of whatever is in the pipeline, whatever these needs are, we have to match that with technologies ourselves. So in terms of screening, we can definitely have a more guided approach to screening, as we know these problem statements quite a bit in advance. We know what the new requirements are if we were to screen, you know, Roche's pharma pipelines, clinical development pipelines. We know probably better than their device teams what it is that's coming along their way. So that's helping us in terms of not just broadly screening things, but really have a targeted approach to that, really focused. And also, Simon, yeah?
Yeah, and I would add to that also a bit opportunistic. And we have a team of very senior engineers, 5, 6 people, different domains. And we look at 50, 60, 70 cases per year. And they spend 1 minute to 10 days, you know? I mean, so some cases we have seen 20 patch pumps. It's okay. We have seen them. It's okay. The world doesn't need another patch pump. You know, so I mean, then we will anyway not look at it. So sometimes you're fast. But then sometimes you realize, oh wow, that's something new. Let's have a close look at it. And so I think it's a bit opportunistic and also opportunity based.
Yeah, and I think also that maybe is a bit the difference comparing us with the larger organizations out there. That there's sort of a, I would say, collective gut feel almost. Like we have a number
collective gut feeling. That's
we
a good one. I should write that down.
Yeah, I think that would be a nice action time. Hey, but I think, you know, it's sort of people stay with Ypsomed and they stay for long with Ypsomed, and they have gone through these searches and screens in the past, and they do recall even that they've gone through that, right? And there also in our industry a couple of patterns that sort of emerge and re-emerge constantly again, like, you know, needle-free injection devices. That idea has been around for 20 plus years. And if we're smart around trying to understand, hey, what has changed ever since, and what's that gap, what's that delta, and why would we now sort of even justify to look at that again? I think it's just really going to streamline that whole effort around screening and target, you know, identification.
So doing co-creation with startups definitely is some risk, and also I think it takes some resources of yours, maybe something that all SMEs have. Do you think there's also a role of the government or government agency like InnoSwiss to support this startup SME collaboration? Hey,
absolutely, and I think these mechanisms exist, right? And I would probably say that we are a little bit ahead, or sort of, you know, at the upper end of what's being treated as an SME. Yes, you know, sort of, you know, with half billion plus turnover. I mean, you can define about, or you can talk about definitional issues there, but there are in Switzerland specifically a number of different, you know, assets and instruments around that can facilitate that. But I think it's also sort of my own observation with Ypsomed and with other organizations. The awareness of these instruments is not necessarily given both on the startup but also on an SME ends, right? I mean, we have only a handful of people who have successfully, filed and got granted an InnoSwiss grant, as an example. So that is, again, not as institutionalized as if you were to collaborate with the Novartises, the Roches, or the Unilevers of that world. I think it's also probably a good way for startups to teach and educate SMEs about these instruments, because we might not be that familiar with whatever's around. Specifically, if you talk about the different, industries and elements like, digital health, I mean, that is new to us, and we probably know ways less about what kind of governmental funded instruments are around than you playing a digital health space. We know a little bit about pharma and medtech, but maybe these new angles might also provide some new instruments where also the startups can guide us through these landscapes.
And there are such means out there, and it depends on. I've found a couple of companies and a startup I'm active in. We do spine robotics, and we never applied for one of those prizes. We never applied for InnoSwiss. We just raised the money and ran. It depends. I think if you cannot convince on seed level, if you cannot do that step, then why not? It's a tool. Unfortunately, now we are in a difficult situation that we need to cut the part of the InnoSwiss budget, and these SME programs might be dropped. So we'll see. But generally, I think take what is out there. I mean, and there are very capable people that support on those processes.
I just wanted to go back to the screening process. I was wondering whether you have a geographical focus on your startup collaboration, whether you are focusing more on Switzerland or you have a broader scope also, toward US, and if you can give us a little bit, few numbers of historical related to, with whom you have collaborated and what are the geographies. Thank you.
The two cases we talk about here, one's based in Iceland and the other one's based in UK. So it's definitely not restricted to Switzerland only. I think the good news about us is we are playing in a very niche market, right? It's all about self-injection devices, and we are, despite being a small, medium-sized enterprise, we are known and we have quite a bit of a reputation out there. So it's also that we can safely assume that if there's something new out there, they might also approach us, right? It's really the two ways how we think about that. So yes, we have certain proactive screening. It's not that we have this innovation outbounds in Silicon Valley and so on. I'm a bit skeptical about that, but maybe our colleagues from Swisscom can convince me about how to run that. We don't do that, but of course still we are acting in a global market, and we try to reach out to these organizations, but always with a strong link to our core. So, and that's why I'm a bit skeptical about some of these outbounds. It's sort of a little bit these ivory towers, and they start to innovate on their own and then flourish on their own without that linkage back to the core. The downside of us being in the core is we are sort of a little bit tied to more incremental advancement, which is maybe also another risk to discuss.
We have to be careful not to stay in our glass box. But every industry has those specialty conferences. And in our industry, the PDA, Prudential Drug Association conference, it's 5,000 people meeting 2-3 times per year, and everybody is there. And just go there, you find people. And this is for us very important. And now we have a certain size. Now we have the biggest booth. Now they will come to us. So it's but I think that is for every industry. That is smart to spend time on those specialty congresses. Thank you very much for your time and interest here to listen to us. Back to Dominic.
Thank you very much. Please give a warm applause. There's one thing I can promise, especially after this session, we shall not rest to work on this bridge, between SMEs and established companies and startups. So yes, that was a start this year with the Startup Supporters Club. But together with you, Simon, and you all, if you want to join, approach us, either Simon or myself. We shall not rest, and hopefully next year we will have a lot more established companies at Startup Days. because I truly believe this is one of the magic of Switzerland, the small but mighty Switzerland. So again, a warm applause. See you in 10 minutes down in the arena for the Newcomers Award.
Thank you. Danke.
Also, das war ein zusätzlicher Punkt, gell? Der Collective Gap.